Person-centered care, it is a care journey together with the team, whereby the person receiving the care is an equal partner in planning of the care. To put it simply, patient is the center of the whole team. This approach indicates the significance of the relationship and partnership between the patient and the healthcare providers. It ensures that the patient's needs, choices, health decisions, beliefs, and values in regards to their treatment are recognized and respected. It empowers the patient and urges them to provide general information, including their feeling, their understanding about the situation, and this will eventually help the whole team in assessment and giving the proper care. This is achieved through a harmonious and trusting relationship between the patient, their family, their friends, and the whole healthcare team, which may include the doctors, nurses, physiotherapists, psychiatrists, dietitian, social workers, administrators, and many others. Person-centered care processes. These are key contributors to person-centered care. They include working with patients' beliefs and values. By knowing patient values and how they perceive and make sense of things happening in their life and their surrounding. They include physical and psychological needs, likes and dislikes. This helps care providers to provide better care because values and beliefs influence the patient's choices and decisions. Once we know their values and beliefs, we are then able to work with them and provide better person centered care to each patient as an individual. Sharing decision making. This involves patients, their families, and other significant people to the patient's life. It is done by considering their values, their worries, experiences, and future goals. This involves providing patients with necessary information and a negotiation platform so that the patient and the healthcare team can reach a mutual understanding and make decisions in regards to their treatment, available care options, and the processes involved. It includes being with and doing with. And as they discuss, there is no strong or weak parties. As patients offer first-hand information and they are the experts of themselves, while the healthcare team provide necessary treatment options and the expertise. Engaging authentically. This involves engaging with the patients and understanding that every interaction is unique by being connected to the patient at that particular time without interruptions. While engaging authentically, practitioners' abilities are of essence based off their knowledge of the patient. They are supposed to have a better understanding of themselves, their own values, beliefs, and bias as they exercise and interact with the patient. Being sympathetically present. Some people argue why the word sympathy instead of empathy. This is because experiences are individualized and it is very difficult for one to fully understand another's experience. It involves interacting with the patient in a way that respects and recognizes the value of the person and their uniqueness, which depends on knowing the patient. It involves being with without the need of doing to. It necessitates the importance of being present at that particular moment. Providing holistic care. This involves provision of care in a manner that looks at the person as a whole by integrating their psychological, physical, spiritual, and social aspect of their life. It involves paying attention to the whole person in a way that provides a general therapeutic benefit as we deliver routine, technical, and physical aspects of our daily care. Person-centered outcomes. By working with patients' beliefs and values, sharing decision making, engaging authentically, being sympathetically present, and providing holistic care, better care experience is achieved. The patients feel they are involved in their care and that they have a voice. It gives a sense of well being and fulfillment to the patient. It brings about existence of a culture that is very healthful and therefore promotes better healing environments. Leadership challenges. As we aim to provide person centered care, we are going to face some challenges. Some of the challenges may include patients' lack of cooperation. As we interact with the patients, some will refuse to cooperate and therefore they may not provide enough information or either ask questions nor seek clarification and therefore collection of incomplete information. Another problem may be communication issues between doctors and nurses. Doctors seem to assume power and authority over nurses, and nurses are sometimes constantly reminded that they do not have the decision making capability and that doctors are to be listened to and their decision is final. Practice innovation and initiative. We look at an initiative that is used by Metro South Health. They strive to provide the best possible healthcare experience at every encounter with the patient, from reception staffs to the doctors. They are committed to provide patients and their loved ones quality health care that respects their preferences, needs, and values. There is a number of ways by which they achieve this. These include use of human touch. This is used to reduce anxiety, pain, and stress in patients, families, and staff members. They encouraged family, friends, and social workers to be involved in the care of the patient whenever possible. They provide patients with information and educational resources so that they can be able to actively participate in their own care. They promote people caring for people. This is where we care for one another, where everyone is a caregiver and have the ability to influence the experience of patients and their families. They strive to promote overall well being. They do this by encouraging their patients to actively participate in other activities to improve their general well being. Some of the activities include exercise, social activities, and other complementary therapies. They make use of their architectural interior designs, which are created to provide a quiet healing environment that create a home-like and welcoming setting. They support connections of spirituality in the healing process of the patients, their families, and staff. They also encourage use of music, artwork, and crafts to enhance the clinical environment. As a result, benefits are realized. These include reduced patient hospital stay, improved general patient satisfaction, and as an organization as well, they experience decreased infection rates, decreased numbers of readmissions, and decreased mortality rates. Thank you.